Our conclusion is that when schools can continue to use that package of preventive measures, that the distance between students in classrooms can be at least 3 feet apart. And that really kind of maximizes their opportunity for in-person learning, and also adds on that added prevention effects of masking and other preventing measures. We want to emphasize that 6 feet of distance or more is more important between teachers and other adults, and between teachers and students. Also in situations where masking can't be used, for example, when kids are eating, and also in common areas where different classrooms or cohorts might mix.
To help that person that's like, I do not want to talk to anybody in here, what can you do?
So we are minimizing our recommendations around physical barriers. And the reason for that is that we don't have a lot of evidence of their effectiveness, and that the actual barriers that are used, especially in a classroom setting, can vary quite a bit. And there are some ventilation experts that suggest that some barriers might actually inhibit ventilation. So because of the kind of the limited evidence on their effectiveness, we're not recommending their use at this time.
Thank you.
I think CDC's hope is that it provides schools options to adapt the guidance and recommendations to their local needs, and understand how to maintain safe operations and create safe, healthy learning environments for all students, teachers, and staff through a package of preventive measures. So we talk about physical distancing, but of course that doesn't happen independently of all of the important other strategies. And so it gives educators an opportunity to really think, what does my community need now, whether that's in-person, full in-person, or hybrid, or some combination.
You know, having kids out of school, we've seen just tremendous downsides. I think we saw that even very early in the pandemic when everything shut down in the spring. We were getting lots of reports of, you know, increased mental health visits, et cetera. Since that time, it's just gotten much, much worse. So, you know, when I think about, you know, the big picture of you know, the risk to children from getting COVID in school versus, you know, what are the downsides of being out of school? I think, to me, you know, having those kids in school with the mitigation measures in place is really, you know, to me, it's almost a no-brainer.